time overhead for a baby being born. So let's see what happens. So I'm going to share my screen. All right, so we are going to do Chapter 5 Notes, Part 4, which is the appendicular skeleton and joints. So at the beginning of the chapter, we talked about how the adult skeleton has 206 bones, and that skeleton is divided up into 2 different categories, either the axial skeleton, which is the head, the rib cage, and the vertebrae, and then we have the appendicular skeleton, which is our limbs, our arms and legs, and our girdles. We're also going to talk about joints, 3 main classifications of joints, and there are further like major subdivisions of joints, but this is the level that we're going to go to in this class. Okay. So your appendicular skeleton has 126 bones out of the 206. And again, it's our limbs, our arms, our legs, our pelvic girdle, and our pectoral or shoulder girdle. Something kind of interesting about the appendicular skeleton is that each limb, arm, leg, actually has 30 bones apiece. So if you're like, oh my God, I need to know 126 bones, a lot of them are exactly the same. Okay. So everything that you see here in purple is going to be part of the appendicular skeleton. So we have, I don't think I have always, here we go. So we have a clavicle, we have a scapula, we have the humerus, the radius, and the ulna. Please be mindful that the arm and the body has to be in correct anatomical position. So your palms have to be facing forward so that the thumbs are pointing out laterally, because this is the radius on the thumb side. So get your thumb up and say right on radius, okay? And then the ulna is on the pinky side. These little bones here are the carpals. Then we have the metacarpals of the hand, and then the phalanges are the fingers. Something interesting about the hands is that all of your fingers have 3 phalanges, except for your thumb and your big toe. Actually, they just have 2, okay? So this is going to be actually the same on this side. We then have your pelvis, which, as I mentioned in class, is a couple different bones. It's 2 coxal bones or oscoxal bones fused together, which each have 3 parts of them, the ilium, the ischium, and the pubic bone. There's the femur on both sides here, the patella. So this is your thigh, and then this is your leg. So the bone of the thigh is the femur, longest, strongest bone in the body. We then have the patella, or your kneecap. We go down to the leg. You have the tubby tibia, which is the medial bone. And then you have the fibula, little lateral bone. Please take note of spelling here. You have the tibia and the fibula. Not tibula, fibula, not tibia, fibia. Tubby tibia, it's shorter. And then you have the fibula, little lateral bone. It is the lateral bone on the outside of each side. Then we come down to your ankle area, and you have tarsals, the bones of your foot, metatarsals. And then again, your toes, you have phalanges. All of your toes, except for your big toe, have 3 phalanges, but the big toe, like the thumb, only has 2. So your pectoral girdle is your clavicle and your scapula on each side. It's a very flexible joint and area. It's very easily dislocated. Okay, so here's your clavicle, and then here's your scapula. And again, scapula, not scalpula. Each of these bones are going to have their own subanatomy, and I know I've mentioned that before. So this is the scapula. However, you have the acromion process. You've got the supraspinatus fossa, which is this little cavity here. You've got the spine. There's the glenoid fossa, which again is a divot. When you take anatomy in college, you can get into all this subanatomy or bone marking anatomy of individual bones. I want you to know and spell scapula. Upper limb, again, arm, leg, they each have 30 bones. So you've got your humerus, is your arm bone. You have your radius and your ulna, which is your forearm, your wrist carpals, hand metacarpals, phalanges. All these 4 fingers have 3 phalanges each. This has, your thumb just has 2. Okay. So here's your radius, here's your ulna. So again, this hand is looking like this to you. Okay, it's not in correct anatomical position. And as you can see, there are 2 phalanges in the thumb versus there's a proximal, middle or medial, and distal phalange. So proximal, middle, distal phalange, or phalanx is a way we can say that as well. So proximal, middle, distal, proximal, middle, distal, proximal, middle, distal, proximal, middle, distal phalange. There's just a proximal and a distal phalange of the thumb. These are the metacarpals, and then these are the carpals. And that's just looking at the whole arm. I'm sorry, it's blurry. Humerus, radius, ulna, carpals, metacarpals, phalanges. And again, I remember right on radius, the radius is going to be on that side. When we do this, the radius and ulna are going to cross, and we don't have a true medial or lateral bone. The pelvic girdle, all right? So we have what's called the bony pelvis, and it's going to help protect our reproductive organs and our bladder. The bony pelvis is made up of 3 things: the os coxae, the sacrum, and the coccyx. All right, so that's part of the vertebral column that make up the bony pelvis, as well as this is the actual pelvic bone that you're probably thinking of. So the os coxae is formed from 2 hip bones joined together that are 3 bones put together. Interesting fact is that the male and the female pelvis are actually shaped a little differently. And my understanding is that, I mean, it's not something that I could personally do, right now, but somebody who's anthropologist, could dig up a skeleton and they are able to look at a pelvis and say, was this a male or a female? They can also look at the pubic symphysis, and that's where it's fused together down at the bottom, to see if that person maybe had a child or not, because there's going to be some dilation and kind of spreading of that after a female has had children. Okay. So this whole thing, the os coxae, the sacrum, and the coccyx make the bony pelvis. Okay. When we're talking about just the pelvis, I guess in general, we're talking about these 2 os coxae bones or 2 pelvic bones. Okay. So this is one and this is one, and they're fused together here, right here. Okay. This is where the femur comes in and articulates. All right. So this is the iliac bone. This is the iliac crest. That part you can probably feel here. This is the ischium, which would be the kind of more inferior posterior bone. And then this is the pubic bone. And the pubic bone here between the pubic and the ischium is where these are going to fuse together in this pubic symphysis that I just mentioned. And for women who have babies, that has to separate a little bit. Oops, put too many buttons. The lower limb, 30 bones each leg. Femur, patella, tibia, fibula, tarsals, metatarsals, phalanges. And it looks like I forgot to put the patella on here, so I'm very sorry. So please add patella. So here we have the femur. This is our thigh bone, our tubby tibia, our fibula, little lateral bone, our tarsals, our metatarsals, and our phalanges. So this is the femur. As I mentioned, every bone is going to have a sub-anatomy. All right, so just the femur here, but then this is the head of the femur that's going to articulate or meet in with the pelvis. This is called the greater trochanter, and this is the lesser trochanter, and these are medial and lateral condyles, and then we've got epicondyles and tuberosities, or things that kind of poke out. Again, when you take anatomy in college, you can learn all of that stuff, and they are there to have muscles and tendons and all sorts of things attached to them. Okay, that's why we have all these bone markings. Or maybe something come out of them, like the foramen magnum is the whole of the occipital bone, where your spinal cord comes out. Looking at the foot, these are the tarsals. They have individual names. I'm not making you memorize them. Metatarsals, And then we have the phalanges. And again, just like the hand, we have a proximal, middle, and distal, proximal, middle, distal, proximal, middle, distal, proximal, middle, distal, in these 4 toes, but the big toe just has a proximal and distal phalange. All right, so that was the appendicular skeleton. And the last thing we're going to talk about is joints. So a joint is where 2 bones intersect or meet or come together. We only have 1 bone in the body that does not have a joint surface with any other bones, and that's the hyoid, that one in the throat there. That's just an attachment point for muscles and ligaments. Or, I'm sorry, muscles and tendons. Joints are going to be classified 2 ways, functionally and structurally. Structurally, with what they're made out of, what type of tissue they're made out of, and then functionally, are they movable, slightly movable, or non-movable, okay? So a synarthrosis or a synarthritic joint is a fixed or immovable joint, and that would be like the bones of our skull that we talked about. Structurally, they are made out of fibrous connective tissue, and they're not going to move. Amphiarthrosis, that means slightly movable. They are cartilaginous joints. And so we talked about your vertebrae, your vertebral column. There are discs on either side, and that is going to give you some movement, slightly movable. Diarthrosis, okay, they are freely movable joints, and they are going to be surrounded by a synovial connective tissue membrane that produces synovial fluid we learned about in chapter 4 that's going to allow for free movement. So this is showing the immovable joints up here of the skull. These are showing the, so this is synarthrosis or fibrous joints. In the vertebrae, these are amphiarthrosis, excuse me, which are slightly movable, and they're cartilaginous joints. And then freely movable joints are going to be like your elbow joint, your hip and socket joint, which are going to have synovial membranes around them, and they are going to be diarthritic. So think about diarrhea, stuff flowing freely through us, diarthrosis, freely movable joint. All right, and that is it.